Thank you so much. It's a pleasure to be here. I want to start by giving you an orientation of actually where you are. I want to welcome you to the San Joaquin Valley. This is a large spread out space with over 24,000 square miles. The foreign-born residents are 21% of our population. We have over 70 ethnicities, and our population is around 3.9 million. We have 105 different languages that are spoken. So it's quite a diverse land with quite a diverse population. And so just to give you an idea of where we are in Fresno, we are absolutely in the Central Valley, and you can see that it is central in terms of north and south, central in terms of east and west. Fresno County is located in California's Central Valley. It does cover 112 square miles in the center of the state, and it is the 5th most populous city in California. It is also the 34th most populous city in the nation, so it is a large area with a number of people. With just under 1 million in Fresno County, it is the nation's #1 agricultural producer. And so given that fact, you would believe that we would not be food insecure, but unfortunately that is one of the issues that we are faced with. The other challenges that we are faced with are a multiple combination of low-wage jobs that creates huge economic inequities, food insecurity, lack of affordable housing, poor air quality, primarily because of our being located in a basin. And all of these really combine and are cumulative in terms of how they are reflected in the health disparities that disproportionately affect African Americans, Latinos, and really communities of color. Next slide, please. So I want to start with our topic of infant mortality because this is really where I came into the picture. Just looking at the statistics, they're overwhelming. And so between the years of 2009 to 2013, there was an 87% increase in African American infant mortality. So that rate looks like 25 infants dying per 1,000 births. That is such a huge and traumatic number to hear that it really triggered a great deal of interest, a great deal of concern, and it really was the starting point for a lot of the work that is being done now. This 25.3 per 1,000 African Americans compared to the rate at that time, which was about 8.1 for white infants. And so the disparity is quite large. And the question really was, why? And I really want to thank some of the partners that you'll hear from later who really stepped in to talk about the why and to really try to address that in an intentional way. Just as part of the context of how this rate was perceived, it was occurring during the time when there was the recession. And so in that 2007, 2008 period of time, what we did notice was that there was significant changes in the funding for one of the programs that we had found to be very successful. And we'll talk more about Black infant health and how that organization or how that project has really supported pushing back on these numbers. Next slide, please. So one of the leading causes of infant mortality is preterm birth. And so when we look at this chart and we look at the rate, what we see is that there's 10% preterm birth rate in the US. But in Fresno County, here again, we can see the disproportionate effect on the African American and Black community. And so even when there have been dips, the dips have been so high that the disparity is still ever present and still not ever mitigated. And so the other population that has a tremendously higher rate is Pacific Islanders and Native Americans. And so you can see from this slide that as rates were going down for many populations, they remained high and remained quite distinct from the changes that we would see with other communities. Fresno County, unfortunately, has one of the highest preterm birth rates in the state of California. While we know that we look at the clinical factors and try to figure out why why is the number so high and why has it not responded to any of the efforts? We know that there are a number of clinical and social factors that affect it. One thing we generally tend to do is to think about what can the mom do? What is she not doing that would help her deliver a healthy baby? Part of the work that I'm really interested in and brought to this table and this perspective was the impact of environmental issues in the communities that have the highest rates of infant mortality. And so looking at things that affect the zoning, the land use policies, the environmental issues and impacts that are in play, but often not talked about and often not considered, is part of the work that is exciting to me because it really means we are trying to get at the root cause. Next slide. So the African American Infant Mortality Study Group was put together based on the fact that these numbers were so outrageous. And the idea was to pull together African American women who had lived experience, but to also put together a maternal child health expert panel that would also provide some insight and some ideas about solutions to solve this problem. The focus groups that met for the African American women really shared a lot of their experiences in terms of the day-to-day practical challenges, things like transportation, flexible jobs, educational opportunities, and a sense of lack of safety in neighborhoods. And the lack of safety includes things like not having streets, not having sidewalks where you could walk, not having access to parks and green space. They also shared that there was substantial maternal stress, that they experienced really a distinction and a difference in their quality of care and their experience at clinics, and that there was neighborhoods that they felt lacked social resources, such as healthy food outlets, grocery stores, green space, and really just amenities that would make your neighborhood feel nurturing and provide you with a sense of comfort. They also identified some of the things that they felt were really needed, and that was really a sense of encouragement and education, a focus on self-care. Many of them experienced a sense of isolation, and we can certainly imagine that at this point, that sense of isolation has certainly increased. The sense of complete neighborhoods, and again, this is the idea that you don't have to leave your neighborhood in order to provide for yourself, for your basic needs. So for instance, in many of the areas where the infant mortality rate is high, there aren't access to grocery stores with healthy foods. The sidewalks may be limited or non-existent. The streetlights may not be operational all the time. There may not be amenities where you don't have to leave your neighborhood in order to shop or to care for yourself. So these were all identified needs that women expressed were important to providing this nurturing and safe environment. They also understood that there were a number of social supports. They just didn't feel that they had connections and that they understood how to connect and how to navigate those support systems. They expressed a concern about the challenges of racism and classism and needing to be sort of in a battle mode all the time and needing to fight that fight. And how that undermines a sense of social cohesion, but again, recognizing that the goal was to complete neighborhoods that would be nurturing, and that in turn would provide a healthier outcome and really push back on this infant mortality and preterm birth rates that we're seeing in our community. Next slide. From this group of maternal child experts and the focus group, their recommendations were presented to the community in a larger format, and priorities were refined and recommendations were made. And they really focused on exactly what we just heard. There was a goal to form a blue ribbon panel that would really look at structural issues around quality of care and a sense of respectful care, and that institutions would be involved in that, and they would maintain a connection to the community in order to make that authentic and to in order to really push for transformation of institutions that they were engaged with. They also wanted to pilot a group prenatal care program that would address the sense of isolation, the sense of maternal stress, and they also wanted to develop initiatives to address their living conditions and other social determinants of health. And so really the recommendations were a combination of all of what they shared with us, those things they experienced, and also the solutions that they thought would be helpful. And so with the recommendations, I'm going to pass it on to Fabiola Gonzalez, the Executive Director of First Five, who was so instrumental in moving this work forward.